Hi everyone, in this module we're going to cover the reproductive option of using donor egg. My name is Lauren Isley. I am a certified genetic counselor and I have a master's degree in genetic counseling. I've specialized in assisted reproductive technologies and infertility for about the last 10 years or so. So what is use of donor egg? So the use of donor egg involves a woman essentially donating eggs, or also called oocytes in the medical field. Although the slide says all of her eggs, that is certainly not the case. We all have many oocytes throughout our life. And the donor donates these eggs to a specific recipient during a fertility cycle. The donated oocytes or eggs are then combined with a sperm source in the laboratory to create embryos. The recipient, or the patient that is going to be carrying that pregnancy, then would undergo an embryo transfer, and that may or may not be preceded with medication or hormone treatment to essentially get that patient ready to receive that embryo. And then in terms of who that donor is, that donor may be known to the recipient in a non-anonymous or known donation is what it's generally referred to as. Or the egg donor may be unknown to the recipient and either recruited by an egg donor program or by an agency. So why and when would a carrier for an X-linked condition pursue this option? So an egg donor may be used in the case where a woman has just in general a lower chance of achieving a pregnancy using her own eggs. And this could be for a number of reasons. So this could include women of advanced age. There's no really set number associated with this. Sometimes we think of women over 38 or over 40 or even older than that, but there's no specific number tied to that. It's just based on the woman's individual biology. Women who have an underlying fertility issues such as ovarian failure, or those who have just had poorer quality embryos after they've undergone previous IVF cycles using their own eggs. An egg donor can also be used to significantly reduce the chance of passing on a genetic mutation or variant to their offspring. So some aspects of utilizing an egg donor to consider. There is a wide range in terms of the odds of success. It can depend on a lot of different factors. So doctors will typically quote patients a very wide range in success rate with egg donors. The risks associated with an embryo transfer are rare and don't happen frequently, but could potentially include infection or damage to the embryo. And in general, third-party reproduction, so that typically would involve using an egg donor or using a sperm donor or using a gestational carrier or using all of the above, in general can carry some psychological complications. Some individuals may struggle with this aspect of a non-biological relationship to their offspring. So it is very strongly encouraged to meet with a mental health professional prior to use of an egg donor. Financial considerations, so costs associated with utilizing an egg donor, again, depend on a number of factors. They can range anywhere from about $10,000 to over $40,000, just depending on who is donating those eggs and whether or not that donor has already gone through an IVF cycle previously and frozen the eggs, or the recipient is using a fresh donor who will be synced with the recipient's reproductive cycle, and also depending on how many donor eggs are needed to achieve a number of embryos or to achieve a pregnancy. So sometimes using a frozen egg donor, meaning the recipient, the patient who is going to be carrying the pregnancy or who is going to raise the offspring, it can sometimes be more cost effective. And this means that those recipients would purchase essentially a group of eggs that were previously donated from a donor and they were frozen. And again, sometimes this can be a more cost effective option because the recipient would know how many eggs in that group she's getting. Resolve is a nonprofit family building organization, and they've actually compiled a list of infertility financing programs and services to help pay for some of these reproductive medical treatments. So I would encourage you to check out that resource. In terms of next steps, contact your local fertility clinic to arrange a consultation and explore options for egg donation. When you're looking at options, it's important to think about whether you would consider using an anonymous egg donor versus a non-anonymous or a known donor, and whether you would use a fresh donor, meaning that the egg donor is essentially going through IVF and egg retrieval in real time, in sync with the recipient's reproductive cycle, versus, as I mentioned previously, the donor has already undergone IVF and egg retrieval and has had a group of eggs essentially frozen that are ready to be thawed for reproductive use. So discuss some of these aspects and recommendations with your fertility clinic. And then also, anytime any fertility treatment is being pursued, including third-party reproduction, it's always encouraged to meet with a mental health professional to discuss some of the psychosocial aspects of using an egg donor. Thank you.